This video will be going over the Jhft hand function test. Firstly, you will meet the client that this test is going to be performed on, and I will explain why this test is chosen for her. Next, equipment, environment, and consent will be discussed, followed by a demonstration of each subtest and how they are completed, scored, and documented. Lastly, I will go over the process of shared decision-making with the client. Judy is a 60-year-old accountant at the local bank. She lives with her husband in the centre of Bendigo and has 2 children, Millie, 37, who lives in Sydney, and Liam, 35, who lives in Castlemaine. Judy loves gardening and pruning the roses in her front yard, as well as cooking for her husband. She likes to keep up with her kids and grandkids over Facebook and text. At the local bank, Judy works on the computer most of the day and likes to get out for her lunch breaks for a walk down the street. Judy was referred for occupational therapy at a rehabilitation centre after experiencing a left hemiparesis caused by a right hemisphere stroke 2 weeks ago. She is experiencing a reduced sensation for touch and temperature, which is making some of her daily occupations quite difficult. She requires help with showering, eating, and often has trouble with dressing herself. Judy is very keen to get back to her daily occupations as independently as possible. The Jhft hand function test is used to assess fine motor skills of the hand, which are required for completing activities of daily living, or ADLs for short. The test consists of 7 items or subtests, each simulating a different area of ADL. The ICF domain for this test is activity. This test was chosen for Judy as it is appropriate for those that have experienced stroke and want to be able to get back to using their fine motor skills for their ADLs and desired occupations. More specifically, it is designed for older adults with hand function impairment or children over the age of 6. To score this test, the assessor records how long it takes for the participant to complete each subtest to the nearest second. Test scores will be recorded on a page from a pad of blank record forms that is received in the test kit. These scores are then compared to normative data results according to age and gender. In this table, the first column between age 60 to 69 for women would be what the assessor would compare Judy's times to. More simply, the quicker you are at completing the tests, the better your hand function. The participant will be asked for consent to complete the test, and they will also be informed that they are able to stop the test at any time. To set up the assessment, ensure that the client is comfortable in their chair and that the table is at the right height for them. Make sure the room is well lit and there are no distractions. The assessor will either be seated next to the participant as shown in the image or just adjacent to them, so they are still able to see the participant's actions throughout the tests. The equipment needed to complete this assessment include a stopwatch, a chair, a desk, 4 sheets of plain white paper, sentences typed in uppercase on a flashcard of a size 5 by 8 inches, 5 more blank flashcards with lines ruled on one side, similar size of 5 by 8 inches, an empty 1-pound coffee can, 2 paper clips, 2 regular size bottle caps, 2 10-cent pieces, 5 kidney beans, 1 regular teaspoon, large chopping board, a C-clamp, 4 standard size red wooden checkers, and 5 number 303 cans. The tests are typically completed with standardized equipment that can be administered to occupational therapists for use with their patients. The test kits include the instructions to complete the test, the items for the subtests, a carry bag, and a pad of 50 blank record forms for the assessor to record times. This test approximately costs $300. The chopping board, for example, looks like this. The lines on the board are spaced 2 inches apart to assist with spacing of the equipment, such as in the simulated page turning subtest, where the flashcards are separated approximately 2 inches apart. The board has a backing that is useful for the simulated feeding subtest, where the participant can use the upright of the board to assist with picking up the beans. The board is also to be clamped to the table so that it does not move during each test. Here are some demonstrations of how each subtests are completed. Please note that these demonstrations were done using household objects to mimic the tests for the purpose of the demonstration. For this test to be reliable and valid, it should be completed with standardized equipment sent out in the test kits. There is an index card placed in front of the participant with a sentence on it, consisting of 24 letters and a third grade reading standard. The card is flipped over so the participant cannot see what is written. The assessor will say, "Go," flip the card over and begin timing, while the participant begins to write the sentence with their non-dominant hand first. The timer stops once the participant lifts the pen off the paper on the final word. This assessment is then completed on the dominant side in the same manner with a different sentence. There are 5 index cards placed approximately 5 inches from the front of the desk, each separated slightly. The task is for the participant to flip over each card one at a time with the non-dominant hand first. The assessor will say "Go" and begin timing until all the cards are flipped over. Then complete the assessment with the non-dominant hand. A large coffee can is placed 5 inches away from the edge of the table. 2 10-cent pieces are placed next to the can in a row, followed by 2 bottle caps and 2 paper clips. They each should be 2 inches apart. The assessor times how fast the participant can pick up the objects, starting with the furthest item, the paper clip. Complete the assessment again, setting the items out on the opposite side of the can with the dominant hand. Place a large coffee can on a board that is clamped to the table. Next to the can, place 5 kidney beans in a row on the side of the non-dominant hand. The placement of the cans and the row of the beans should be against the upright of the board. This is so that when prompted, the participant can use the back of the board to pick up each kidney bean with a teaspoon, starting from the outside bean. The assessor will time the participant to see how fast they can complete the task. This is then completed with the opposite setup on the dominant side. Place 4 checkers in a row on the board which is clamped to the desk, 2 on each side of the centre of the board. Once instructed to start, the participant will stack the checkers on top of each other one at a time. The participant completes this task as fast as they can, beginning with a non-dominant hand whilst the assessor is timing. Then complete this test on the dominant hand and set up in the same way. 5 empty cans are placed on the table with 5 inches from the edge and all 2 inches apart. They are placed just in front of the board which is clamped to the desk, with the open side of the can facing down. The participant is asked to place each can on the board one at a time as fast as they can, while the assessor records the time. This is then completed on the dominant side, set up in the same way. 5 full 1-pound cans are placed on the table 5 inches from the edge and all 2 inches apart. They are placed just in front of the board which is clamped to the desk. The participant is asked to place each can on the board one at a time and as fast as they can, while the assessor records the time. This is then completed on the dominant side and set up in the same way. Once the test is completed, the assessor will discuss the results with the participant and then go on with possible interventions to help with improving their hand function. The occupational therapist will discuss a range of assistive devices with Judy that she may be interested in to help with areas on the test that she may have struggled with, as well as activities of daily living that she believes are of most importance to her. Home modifications can be discussed to ensure Judy is aware of all of our options, as well as other methods of hand therapy to retrain muscles and pathways in her hand, so that she can have greater function and be able to text her grandkids and type at work with less strain. The assessor will then make sure that the patient has understood what they have discussed. I hope this video provides you an insight as to how the Jhft hand function test is completed and who it may be appropriate for. Thanks for watching.